Ian McFadden, thank you for joining us today for the RCM Innovators series. I'm excited actually that you're in this seat because you're going to help us explore this from the standpoint of the rural health systems. Although you have already mentioned that you guys are in a little bit of a unique situation, so let's set the groundwork here.
Okay.
Why is it that you describe you folks as somewhat unique among rural systems?
Well, we are a rural system. We've been working out of Sweetwater, Tennessee since 1936.
Wow, okay.
We've taken care of that community. We're the only hospital in the county. We serve a 4-county rural market that, and one of those counties doesn't even have a hospital. So,
okay.
So we're the place for them, our place of destination. It's a unique environment because we pretty much have very little competition. I think the closest hospital is about 20 miles away in another neighboring city. They're about the same as we are. Knoxville is 40 miles north of us. Chattanooga is 60 miles south of us. So we don't get a lot of competition out of those areas either.
Okay.
So we're kind of unique. We have our own captured market, and we're able to do fairly well with that.
Now, I mean, it's sort of a general presumption that the rural systems aren't at the forefront of innovation, right? That they tend to be a little bit further down the road. The Amazon packages get to you guys last, so to speak, right? And that includes some of the most cutting-edge innovations. But you folks have pretty advanced systems.
Yeah.
First of all, just to describe to the audience what those systems are, and then how'd you pull that off?
Well, we've been fortunate. Over the last several years, we've had pretty good managed care contracts.
Okay.
Really
sure.
helped.
Yeah.
Okay. So we're able to basically build some revenue, put some cash in the bank. We basically have funded everything through operations, so there's no debt.
Yeah.
The facilities are fairly modern for the most part. The technology is fairly modern. We keep up with the latest capital equipment. We just added a robot, so we've got that surgery.
Like a Da Vinci?
Yeah, Da Vinci.
Wow.
Is there. We're getting ready to add a cath lab next year. So so the organization is pretty much, even though it's a 70-bed facility, it's fairly advanced.
Clearly.
We have over 130 doctors working there.
Yeah. So, I mean, I appreciate the payer contracts being a component of that, but it also seems like it can't just be that you're funded in the right way. You have fostered innovation. You've built, would you say, a culture of innovation?
It's been well run because we've had to depend on reaching out to our patients, even though they're in a self-contained market, they are dispersed. So we have to basically go to them. We've not really rested on them coming to us, and that's been really key. So we've had outreach centers formed, urgent care centers opened up, different physician satellite clinics, and we have them in every county that we serve. So that's been a real advantage for us.
So I'm checking an assumption that I have real quick, so tell me if I'm wrong about this, but there is clearly a trend of a brain drain coming out of health systems, a lot of the talent and revenue cycle being gobbled up by revenue cycle outsourcing organizations.
Right.
I have an assumption that I'm spotting in myself that's perhaps more a problem in the rural areas, that drain, the sound of that vacuum is very, very loud in those areas. Is that the case?
Yeah, to a certain extent. We don't have a lot of media.
Okay.
Social media is really it for us. So there's no television covering our organization.
I get you.
Like that. But we do well with getting everything put out on social media. And we have a really well-developed new website that does a lot for us.
Okay.
So you can actually get everything done registration-wise, billing-wise, into the patient portal, getting everything, all the history and physical, all that stuff can actually be entered in before the patient actually has to see the service.
Wow.
Or have the service performed. Yeah.
So again, you've managed to you clearly have people who are thinking like right at the current edge of what's happening.
Well, automated. Yeah.
How are you? And this so again, one of the things we're trying to do in our conversation is to share intelligence that you clearly possess with other health system leaders. How have you attracted this kind of talent into your organizations? What is it that you're doing to give them opportunity to provide an environment that they're attracted to?
Well, we've been proactive. I
Okay.
think we actually entered our EMR system almost 25 years ago.
Wow.
Which is I guess way ahead of most places.
Way ahead.
We have a partner called CPSI. They're our IT provider. They actually service maybe 600 clients across the country.
Okay.
Most of them community hospitals like us.
Sure.
And they have pretty well-developed products, well-advanced products. In fact, we're just introducing one called Patient Connect, which actually has the patient receive a text, or the family member receive a text, and they can actually get everything done registration-wise before they come into the hospital.
Yeah.
Yeah, and, get an appointment set up, everything else that we need to do with them, or actually go to the website and get it done.
I see.
It's really a fantastic system. Everybody has a cell phone, so we're able to actually work through them through those apps. But it's unique for a rural facility. We've actually brought a lot of rural people towards our hospital.
Yeah. Okay, so it sounds like the relationship that you guys have with your technology vendor has been key to allow you to stay at this kind of front edge of what's happening with innovation in healthcare. What guidance do you have for health system leaders as they look to this landscape of technology vendors to create strong partnerships, to kind of weed through the...
It's the only way to go, really, for the future, because the patient is demanding immediate response, which they deserve that.
Yep.
The patient is demanding the best patient experience possible.
Yes.
Which means no delays.
Right.
Hands-on care the way they want it, well-informed.
Yeah.
They want their family members informed. You can only accomplish all that through technology, and you need the best partner that can help you with your technology, and I guess initiatives, if you will.
Sure, I follow you. Has there been any kind of technology initiatives that you've approached and asked first the question, build this in-house or go with a vendor, and how have you found a resolve in those questions?
It's interesting you bring that up. We had, we actually took doctors. We employ very few doctors, by the way.
Oh, okay.
We only have I think 2 employed. The rest of them are in this group. We call it the Sweetwater Physicians Group. It's a new concept called HOPD, Hospital-Owned Outpatient Department, but you actually take your doctors and put them into this structure, and they're part of the hospital.
Oh, okay.
So you actually own the practice, but not the physician. I mean, you actually own the clinic, but not the practice. So the physician still stays independent. CPSI helped us put all that together. So that was one of the advantages of being able to restructure, and actually you can as a hospital charge more facility fees for clinics.
Okay, so right away, I have this nervousness about this because it sounds like a billing nightmare. Is it?
It is a billing. Yeah, you gotta have split billing.
Yeah.
You gotta. Yeah, I mean, you have to be really careful with that. So revenue cycle becomes critical.
Sure.
So that's why you need a partner that can actually help you with that, and they actually have people on site helping us with the revenue cycle piece as well.
I see.
Yeah.
Oh, the partner is staffing your organization with their own
helping
people.
to. I think we've got a manager through them.
Okay.
We've got consultants on site helping us with the processing of the bills. So they've been very helpful with that.
But then ultimately, if I'm understanding you correctly, the patient's experience of that bill is it's either on the phone or it's very simplified. So that's all invisible to them.
Exactly.
All the machinery is going on the back and the staffing that's going on the back.
Exactly.
Super
The
clean
patient doesn't
patient
see
experience.
all the running around that we have to do to make that work.
Yeah. So. I mean, you guys are, like I said, right at the front edge here. What's the next thing that you're looking at?
Well, I think for us, it's growth.
Growth.
We have to be able to grow within the market because we're not too complacent. We understand that even though we're in a rural market, obviously there's potential for other suitors to come in there, put their services in there. So we want to actually do as much as we can to regionalize our services and saturate the market with our services.
Yeah. A great time for growth. A lot of organizations.
So we're adding urgent care centers throughout the region.
Yeah.
Adding more physician clinics, more practices.
Yes.
Adding more specialists coming into the hospital. So now we do orthopedics, vascular surgery. We're able to do a lot of things, and soon to be, cardiology and.
Wow.
So we actually we're able to do a lot of things that most rural places can't do.
Well, and what a great time strategically to be in a strong cash position.
Yeah.
As some systems are struggling.
We're independent,
Yep.
So we're not part of a system. We don't know if that will be the way of the future, but that's the way it is for us now, and we're able to afford that right now.
So you talked about certainly other suitors, I think was the term that you used.
Right.
I'm curious to hear from you if you guys have a perspective on organizations like Amazon, Apple, Walgreens, CVS, all angling for the whatever it is, $2.3 trillion market of healthcare. You know, I think people in this space, they classically think of when you say alternate suitors, we're just talking about different health systems jockeying for geography, but it's not that anymore.
No.
What's your perspective on those organizations?
Retailers are competitive, or at least they're trying to be.
Yeah.
The first way that they have really impacted us is they're hiring our people.
The brain drain.
They're hiring our people. They're actually getting, able to offer more than the local minimum wage or whatever, get entry-level people into their shop, get them working, helping them with healthcare initiatives. Our focus now is to try to get that balanced.
Right. So you're finding an increased competition in the labor space.
Exactly.
In the talent space.
Yeah. It's, for us, it's not just the lack of nursing staffing, which has plagued everybody. Obviously.
Yes, so much.
It's the lack of entry-level staffing.
Is it?
I mean, people that make, $12, $15 an hour, they can actually get that anywhere now. Okay, I mean, it's not just us. So we've got to really compete in terms of getting the entry-level people that can actually come in and help us with these different concepts and programs.
Yeah.
Rather than being over with Walgreens, okay, or
sure.
Walmart or whatever. I mean, it's a competitive battle.
Yeah, they're all in looking for.
And they're trying to open up clinics just like we are. Yep. They're trying to. I mean, they're trying to practice medicine like we are.
Happening. Yeah. So it does sound like your technology partner has been integral in the successes that you've had.
Yeah.
Do you have guidance for health system leaders who are either currently engaged or looking to get engaged with technology partners to help them achieve the kind of success that you have achieved with your own technology partner? What would you recommend for them?
Well, I think, first of all, you have to be open that you cannot do it all on your own.
Okay, sure.
That was a hard lesson for us. For many years, we'd say, we don't need anybody. We got our own little marketplace here. We're fine. Okay. Well, as you just mentioned, retailers are now into the business. Competition is still looking at markets where they can actually hopefully achieve market share. We cannot continue to do this alone anymore.
Yeah.
We've got to have help. IT partners are really one of the key ways that can help us bridge that gap. And I would encourage other systems, not just IT. I mean, purchasing vendors.
Sure.
Look at major suppliers.
Yes.
The GPOs, they all can help, but you cannot go alone on this anymore.
Okay, so being open, step one.
No matter how big you are, yeah.
Oh, so I was going to ask you, that was another question, do you really feel like that's a rural thing or?
No.
Okay.
No, everybody's going to have to
Everybody
have
needs to be open.
Yeah, even the major systems, as they continue to consolidate and grow and add hospitals and other assets, you got to pay for all that.
Yeah. Yeah.
So you're going to need partners to help with that.
Okay.
So I think the Epics of the world, the Cerners, all these big IT companies, they're actually doing more than just supplying an IT system.
Right. Oh,
they're partnering for all kinds of things.
Absolutely.
Yeah.
All right. So being open, step one, meaning, okay, I'm down to explore the market. I'm open to whatever, maybe pilots or betas or that type of thing, conversations with vendors.
Right.
I'm bring that intellectual honesty. I'm not going to be able to do this without vendors.
Right.
What's a second step? What's another thing that provider leaders can do to make sure that when they actually engage in those relationships, they're open to it now? We're going to go. What suggestions do you have for them to get the kind of success out of a relationship that you have seen?
Well, I think really understanding the consumer, I think is critical, because the pandemic didn't just change the employee. Okay, now employees are much more of a commodity now. I mean, more in demand. Obviously, people are having to make decisions about what kind of work they want to do. The consumer is making decisions about where they want to have health care.
Yeah.
And what they want in that healthcare product.
Yeah.
And if you're not just because you're the hospital or the lead provider, you don't have all the answers. Okay? Yeah. Other people have answers. Vendors have answers. IT companies have answers. Purchasers have answers.
Right.
Everybody else has answers. You need that knowledge.
Yes.
To be able to fully take care of the patient. So the consumer is looking for innovation. The consumer is looking for different alternatives of how to get things accomplished. How can my care be maybe reduced hospital stay reduced a day or so?
Yes.
Do I have to stay that long? Do I have to continue to have another doctor appointment? Can I not do telehealth?
Right.
Can I not do virtual health? And hospitals don't always have the answers for all of that. You got to have help.
Yeah,
So, yeah.
I share your thinking there. You mentioned the pandemic a moment ago.
Yeah.
Something that I observed as we went through the pandemic is that initiatives that health systems were undertaking just seemed to have sort of a hand wave of timeline estimation. Oh, that's a 2-year initiative. That's a 3-year initiative. And then during the pandemic, we learned things that had been hand waved for a 2-year minimum got accomplished in 2 months, or even just weeks.
Yeah.
Big, like, wow, okay, is this a revelation of what's possible in healthcare? And then I'm starting to see kind of a rollback, like, the language is coming back. Oh, that's a 2-year initiative. That's a journey, right? That kind of thing.
Yeah.
Did you guys surprise yourselves with your capacity to innovate and how fast? And did that instruct you going forward, or are you settling back? And what are you seeing in the industry?
I think COVID changed our total dynamic.
Wow. Tell me more about that.
It just, when you have a pandemic that your hospital's equipped for 60 to 70 beds and you're taking care of 100 patients a day.
Oh, sure, yeah.
How are you going to do that?
Right.
Okay, and where are you going to do it?
Yeah.
And how you know the patient is going to get what they need? And there is no way to make that work. Okay,
right.
So what we found out very quickly is that, yes, we're the only hospital in town, but maybe at times we don't need to be. At times I need to be able to transfer people out to where they can get cared for that I can't care for them at that moment. I need to find avenues where patients can get what they need to. And the terrible thing about the pandemic is everybody was so packed, everybody was full, everybody had a shortage of labor. Patients couldn't move anywhere. You were stuck.
Oh, yeah, sure.
You're stuck.
Yeah.
Nobody has ever considered that. Wow, I didn't think it was a bad thing to be full and not be able to have patients move, but it's a bad thing. Okay, it's like I can't get anything else done here.
Yeah.
And at the same time, my workforce is screaming, I can't do this anymore. I'm too tired. I can't work these long hours. You can't get me enough help. I need to find something else to do.
Uh-huh.
We had no idea people would leave the healthcare workforce.
Yeah. Oh,
but that's
yeah,
what's
sure.
happened.
Yeah.
Okay. People have left it, and they've left the business altogether. Like, I have a big heart, and I love taking care of people, but not like this. So let me find something else to do. And that's nobody prepared for that.
Right.
We didn't prepare. We're a rural hospital. People that work in our hospital have worked there 30 years plus.
Yeah.
I mean, they don't know any other place to go.
Yes.
But they said, I can't do this.
Wow.
Okay. And they're saying that to people that they know have known their whole life. The thing about a rural hospital is that you're taking care of people that you know.
Right.
I know my
sure.
neighbor down the street. He's come to see me to take care of it, and I've had enough. Okay, I can't do it. So we weren't prepared for that.
Yeah. Wow.
Okay? And that's been the one thing. Now we're looking at all these staffing agencies and finding ways to get people into the hospital to care for other people.
Yeah.
There's just not enough out there.
A lot more traveling nurses and that type of thing?
We've never had a traveler in our hospital in the entire history until last year.
No kidding.
First time ever. Because in Sweetwater, everybody works at the hospital. That's the biggest employer in town.
Sure.
Everybody works there.
Sure.
You get a job there, you're set.
Yeah, I get you.
Not anymore.
No.
I had to find travelers from agencies all across the country, and the money that we had to pay those people was just ridiculous.
Yeah,
I mean,
it's ridiculous. Yeah.
It was probably the most trying time I've ever had in this industry. I've been doing this almost 40 years.
Wow.
Okay, I've never had these kind of issues having to deal with that.
So, you've been in this for 40 years. The health system, your health system, since the 1930s. Did I hear that correctly?
Right.
You have stepped in the pitfalls, and organizations that are looking to kind of move forward, engage vendors, that type of thing, they're going to find the same pitfalls you found.
Right.
What are a couple of the pitfalls that you remember that you fell in? What was that like, and what guidance to avoid them?
I think the first pitfall you're going to get into is I'm not able to make the margins I was making before. Okay, and that for an organization that's used to making money.
Yes.
And all of a sudden those days are gone. Okay.
Yeah. Yeah.
How can I make a margin? How can I make this work now? And I've got a board who's like, well, we'd like to see a profit soon. You know, and I'm like, guys, I'd love to give you one, but I've just increased payroll $3 million in the last month.
Yes.
I've had to add all these travelers, all this other stuff that we've had to do, all this technology that we've had to put in place just to keep patients coming to us. The margin's going to be a little bit harder.
Yeah, I get it.
Okay, so I think that's the first thing. I mean, I know everybody talks about the financial challenges of a hospital.
Yes.
But when you're a hospital that's been successful for a long time.
Oh, yeah, sure.
And now you're starting to say, hey, you know, I don't know how to get back there now.
Yeah.
Okay, in this new environment. That's different. Mm-hmm. And so that's one of the things that's the pitfall that we've had to really come across. And then the other pitfall is, are we going to be able to have the same providers that we've had in before? You know, I've talked a lot about nursing, but physicians, I got to tell you, they're decreasing by the numbers as well. Okay, now we have to have mid-levels. You know, people who haven't really been practicing in the hospital, you know, nurse practitioners, PAs, they're now a standard.
I'm just curious on this. Are you seeing that more? You said you only employ directly a handful of physicians, most of them with the organization that you're partnered with. Are you seeing it more with the partnered organization or more with your own phphysicians?
Both.
Both, just like even across the board.
You really, in today's environment, if you have to take an office visit, and it doesn't have to be just us, any well-advanced hospital or community system, you're going to probably see a mid-level first. Mm-hmm. You're probably going to see a nurse practitioner. I mean, the doctor, unless it's a primary care doctor that's still trying to build a business, they're not, I mean, they'll see you after visit 2 or 3. Okay? Yeah. And it may be a telehealth visit at that point.
Sure.
You know, I mean, they're not going to put the time in because they're trying to get their numbers up too, and they want to see as many telehealth visits as possible.
I get you.
Okay, so the mid-levels can, you know, take their time and see you. But the doctors, they're going to want to basically see you when it comes time that they think is necessary to see you.
You know, Ian, what's been fascinating for me in this conversation is that you guys are a rural system, right? And yet you have so many of the technologies that the leading systems are just now figuring out. I think that what you've done as an organization represents leadership in American healthcare. I would ask if you had a thought to share for kind of American healthcare leaders.
Well, I think it's because I've been doing this such a long time, and we've gone through, you know, provider-based reimbursement, and now we've gone through fee-for-service, and now we're going to value-based.
Right.
You know,
yes.
You know, we have to get length of stay down. You have to create value for what the consumer's buying. At the end of the day, if I were to have a takeaway, we have to remember the consumer is now in charge.
Oh, yeah.
It used to be the provider was in charge.
Right.
Okay. We used to say, well, the doctor, I'm gonna take care of this doctor because he's going to bring X number of patients to me.
Right.
Okay. I'm going to recruit this doctor because he's going to bring all these, you know, bodies to me. Not anymore. You have to reach out to the consumer. It needs to be a grassroots approach because the consumer can say, I don't want to go to that doctor anymore.
Right.
Okay. In fact, I don't want to go to Sweetwater at all. I want to go to Knoxville.
Right.
They have more sophisticated care. Why am I going to Sweetwater? The biggest problem rural hospitals have today is out-migration. Because the consumer thinks, you know, why am I going to go there? That's a first aid stop.
Right.
I'm going to where I can get cared for. Okay. So as a rural hospital, you have to not only make sure that you keep the patient with you, you have to build a base to where they can get secondary care as well as primary care. And that's a major challenge because that's a lot more expensive.
It sounds like such an intuitive shift, but I know there's a lot of subtlety to that, and I think it's excellent guidance.
Yeah, the consumer is going to be at the top of the food chain from now on, and that hasn't always been the case.
Yeah. Jan, thank you for sharing your thoughts with us today. I think this is a valuable contribution. So fascinating to hear from the rural perspective and to see, like, let's look way out there and then, wow, what a gem of innovation taking place. Thank you so much.
Thank you very much, Colt.
Yes, absolutely.
It's good being with you.
Likewise.